Let's get more now from Christian Lindmeier, who is from the World Health Organization. He joins us from the headquarters of the WHO in Geneva. Thank you very much for being with us today. What is the latest that you're hearing from your teams in Gaza? What are they describing about the nature of the injuries that medics are having to deal with there? And can you confirm anything about what's been happening at the aid distribution points where there have been reports of so many civilians being killed?
Well, thanks for having me, Paul. So these are important points, exactly. So first, we do not have personnel at the aid distribution site, so we don't have a first-hand witness situation there. But our staff are at the hospital, or our colleagues at the hospitals, and that's where we get the reports from the wounded coming in. And many of these wounded have fresh shot wounds or shrapnel wounds, which is a clear indication and therefore indirectly confirming the stories about being shot around the aid distribution sites, the militarized aid distribution sites. Let's be clear about that. This is what we see. This is what we hear from people. This is the evidence we get from our teams and from the medical teams on the ground.
And so what are the biggest priorities now for getting help to people in Gaza with a health system there clearly so devastated?
Well, there are two things right now. The people are dying, the people are starving, they are sick. So they need the food items and water, fresh water, but that's not primarily WHO's role. We are there to deliver the medical supplies. And actually this week, the first time, we had 9 trucks going in the beginning of the week, and yesterday, again, 4 trucks. And that's the first time since 2nd of March. So the first time nearly since, 4 months. These supplies are heavily needed, desperately needed. And important to say, to disperse any rumors, none of these trucks was attacked, none of these convoys was looted. All the materials arrived safely according to plan in the warehouses, and from there it gets distributed further into the clinics and health facilities as needed. If we get to those clinics, we don't get to all, and not many are operational anymore anyway.
Okay, thank you for clarifying that important point. In terms of a potential ceasefire, of course, both sides really welcoming any possibility of a ceasefire that Donald Trump seems to be quite optimistic about. If that does go ahead, just how quickly do you think humanitarian aid, medical supplies could get into Gaza? You mentioned these 9 trucks. Clearly a lot more is needed very quickly.
Paul, aid is outside the door. Let's be clear. Outside the border crossing, the Kerem Shalom, there are the trucks sitting and waiting since weeks and months. So the moment the key opens, trucks can come in. I mean, there's a lot of back logistics that necessary. Ben Gurion Airport has been closed during the air raids and the war with Iran. So that's the supply route coming in from there. Ideally, we would have separate supply routes through Jordan, through Egypt. Those have both been closed recently. So if those all open up again from our side, that would help tremendously to speed up the efforts. But again, trucks are outside. They can come in any time, and then with the fuel and everything necessary, because a truck coming in is one thing. It needs to be reloaded into trucks inside Gaza and then distributed. Sure, there's a lot of logistical effort behind it, but all is possible. It was possible during the brief ceasefire we had, and it will be possible again. And let's be clear, a ceasefire, peace, is the best medicine for everyone.
Indeed. Well, Christian, thank you very much indeed for sparing the time to talk to us today. That's Christian Lindmeier, a spokesman for the World Health Organization.